Hello, Oklahoma. I wanted to give you an update on a number of things we've been working on as a state as we continue to respond to COVID-19. Most recently, we are ramping up testing this week. Earlier today, Commissioner Cox notified all of our state departments of health that we are lifting some of the restrictions we had on who could be tested for COVID-19. As of today, the state of Oklahoma has 13,600 test kits available, and Oklahoma State University has opened up its lab and can do 2,300 tests per day now. Anyone with symptoms of COVID-19 or those who have come in contact with someone with COVID needs to be tested this week. Providers, healthcare officials, hospitals, county drive-through testing facilities. If you can hear me, please begin testing all of those folks today. Anybody that has symptoms of COVID-19, we want you to test them. That's the main point to get across. So the symptoms include a fever above 100.4, coughing, shortness of breath. One of the things that will help the modeling as we're trying to model these peaks is more testing. That's why it's so important that our healthcare providers and our local health departments test as many people as possible. I want to stress that our state can process these tests in state now. Do not turn people away who are showing symptoms of COVID-19. We have currently 6 drive-through facilities available. We just opened up in Altus and Woodward and Lawton. We'll be open Adair later this week. By the end of this week, we should have 13 mobile testing facilities available throughout the state. You can find a list of these testing sites at coronavirus.health.ok.gov. That's coronavirus.health.ok.gov. The best way to slow the curve and stop the spread of COVID is more testing and tracing, as well as continuing to practice social distancing. That is staying 6 feet away from someone. I've been working with our state epidemiologist and experts from our state's research universities, University of Oklahoma and Oklahoma State University, to try to find the best data to help drive all of our decision making. And I'm sure that many of you have seen online projecting the spread of COVID is not an exact science. We have some models and predictive analysts that are showing spikes in early April. We've seen early April, we've seen late August, and kind of everything in between. It's kind of like predicting hurricane forecasting. The farther that hurricane is out in the ocean and away from land, you have the cone of uncertainty. You've got just really, really wide. As we get more testing, as we get more data, that cone of uncertainty will start to narrow and we'll have a more specific focus. So we're looking at many scientific models. IHME is a model the White House has referenced in recent days, along with the Department of Health has their models. Oklahoma State is also looking at several different models that they're informing us with. The numbers fluctuate based on those models, but the model that we're focused on right now when we look at everything is a kind of a late April peak is what we're planning for. As a result of that information, this is the right time to take additional measures here in Oklahoma. In accordance with President Trump and the federal government's guidelines, I am extending all the provisions in my original executive order through April 30th. I'm now applying them to all 77 counties in Oklahoma. This means that all non-essential businesses will need to alter their operations and temporarily suspend services that require social gatherings until April 30th. Specific examples include businesses like gyms, movie theaters, tattoo parlors, massage parlors, barber shops, hair salons, amusement parks, performance halls, museums, restaurants, and bars. Restaurants may stay open for takeout and curbside delivery. And I encourage Oklahomans, we need to continue to support our local restaurants. I also want to remind Oklahomans how important it is that we limit physical interaction. This is a lot about personal responsibility and maintaining that 6-foot distance and 6 foot apart from each other. I know how much these decisions affect people, and I have agonized over all of these decisions. But this is the right time to take these steps to protect healthcare workers, our hospital systems, and each other from catching COVID-19. These next few weeks are going to be really critical to slowing the spread in Oklahoma. So please, for the sake of your family, your friends, your neighbors, let's do the right thing and work with us together to continue this social distancing. We will all continue to need kind of basic items like the grocery stores, but the grocery store is not the place for family outings. Please send one family member to get your groceries if at all possible. Your grocery store employees will really appreciate this as they are working long hours to keep the shelves stocked, and I know they'll appreciate your help. My executive order also suspends elective surgeries through April 30th. The reason behind this is twofold. Number one, it'll help us save PPE for hospitals and for our first responders. Number two, this will free up nurses, other healthcare professionals who we will need on the front lines as we expand our hospital capacity. My Safer at Home order also continues to apply through April 30th for all Oklahomans 65 and older or those that have a compromised immune system. 70% of Oklahomans who we've lost to COVID-19 were over the age of 65. The other 9 people had underlying health conditions like heart disease or diabetes. This is why it is so critical for those Oklahomans to shelter at home unless you need to get groceries or go to the pharmacy. If you are in a safer at home population, do not have visitors to your home during this time or gather in groups. The safer at home restriction also restricts visitation to long-term care facilities or nursing homes. These facilities have been working hard to enforce those measures, and they must also remain in place through the end of April. Nobody understands the situation on the ground in our cities and counties better than the people who live in them. I understand some mayors and county commissioners will feel the need to take additional measures in their communities, and it is important that we all work together to save lives. My number one goal is the health and safety of Oklahomans. For those Oklahomans who have lost their jobs, I am committed to helping you. I know many Oklahomans have had trouble getting through to file unemployment claims. We have experienced over 20,000 calls per day to our unemployment department. And I want you to know we've already added staff and additional technology to try to get through that backlog. The best way to file for unemployment is to go online to ok.gov. I know how stressful these times are for so many of us. Please know that we're working to help get these claims filed faster, and we'll continue to add more resources to work through that backlog. Thank you for your patience as we continue to work on this. I also want to talk to you a minute about our PPE inventory. This week, Oklahoma received our full supply from our federal allotment in PPE. We must reserve this supply for those who are on the front lines delivering care to COVID-19 patients. Hospitals with ICU beds and individuals being treated for COVID-19 will receive more PPE when it's needed. Later today, we are also deploying much needed PPE to our first responders across the state as they walk into unknown environments and respond to emergencies. If you are a first responder who can hear my voice and you need PPE, please let your local, your state, your county emergency manager know so they can submit a request with the State Emergency Operations Center. The Oklahoma Department of Emergency Management has already logged dozens of requests from local jurisdictions and is continuing to take additional requests every single day. The Governor's Solutions Task Force has been working day and night on the best way to handle the surge and demand we're expecting in our hospitals. Last week, I instructed FEMA and the U.S. Corps of Engineers to start working and analyzing sites across our state so we can build field hospitals. They have been inspecting a number of sites, and we should have their final report back within the next 24 hours. Oklahoma, I know this is a really difficult time for all of us, and I realize that many Oklahomans are anxious right now, or they're fearful of the impact this virus will have on their health or their loved ones' health. They're also, many of you are nervous about the impact this is having on our finances and our jobs, most of us are just not sure when life is going to get back to normal. We're all in this together. We need everyone pulling on the oars together so we can get through this quickly and we can get things back to normal. We need to stick together to protect ourselves, our families, our loved ones, and our state. And I want to close today by specifically thanking our healthcare workers, our doctors, our nurses, all those on the front lines, our first responders. And I also want to give a special shout out to our daycare workers, child care workers as well. We know how important child care is for all those of you that are working on the front lines so they can continue to go to work and keep their fellow Oklahomans safe. So thank you for being with us today. God bless you. God bless the state of Oklahoma. And let me open it up to some questions now.
Sean Murphy, AP.
Hi, Governor. Thanks for taking my question. I was wondering if you can kind of explain why you think it's a better idea for your office to be in control of the health department as opposed to a governing board of medical professionals, especially during a crisis time like this. And also, if you have any concerns about Gary Cox lacking the statutory requirement to lead the agency.
Sure. I think no. I think Commissioner Cox has done yeoman's work in the midst of a global pandemic. He and his team have been exemplary, have worked in concert across the state of Oklahoma, and I admire really all those who are working both in state government on the front lines of the healthcare complex. It has been an exemplary partnership during unprecedented times. As to the governor's authority, I think the professionals that have been brought in, including Dr. Casey Schrum, have worked alongside professionals from the medical community. In fact, as an example, 3 times a week, including this morning, we visit directly with representatives from the medical community, including nurses, doctors, dentists, pharmacists, and the hospitals. Again, that is a 3 times a week cadence in addition to the one-off conversations we have. So they're fully at the table, fully a part of this. I don't think the governor would have it any other way but to have us fully informed by the medical community, by our provider community. It takes all of us together on this, and I think that's the effort you're seeing now.
Dylan Richards, KOCO.
Hey, Governor, thank you. My question was just, what changed your mind to extend this to all 77 counties? Did you get new data? And can you release that data that you're looking at or point us toward what data you're looking at in terms of when we're going to see a spike and kind of what's driving your decision?
Well, we initially did the non-essential businesses in the counties that had a COVID case, And remember, this is changing rapidly, day by day, hour by hour. And so we had 16 counties at that point. Now I think we're up to 40 counties. And so we just wanted to expand that to all 77 because these next 3 weeks are going to be really, really critical to continue to flatten that curve, keep us safe, make sure that we don't outpace the capacity in the hospital. So that's really what we're working on. The data came in and we're looking at the models, what they show us. So we'll release some of those models to you. We can email those out today. But again, like I said, we've got Oklahoma State's model, University of Oklahoma's model. We've got several different models that we're basing those decisions on, and this is the right time to make that decision till April 30th.
Chris Castile, Oklahoman.
Governor?
Yeah, go ahead, Chris.
Okay, I was wondering, under these models, how many ICU beds are you going to need and how many ventilators? And along with that, some of your counterparts have talked about states having to be in a bidding war for ventilators and other PPE. If you could describe that and what it's like to try to get ventilators right now. But I am most interested now is like under your scenarios, how many ICU beds and ventilators are you going to need when this peaks?
Yeah, we're going to be showing those peaks probably tomorrow, the next day, whenever I release some information on our surge plans and our plans to what hospitals we're going to build and how we're going to spike up. But again, the modeling at this point shows between 4,000 beds needed to 6,800 beds needed, depending on what model you look at. So we're going to plan for an early peak, but we're on a nice trajectory in case this thing peaks later. Ventilators. We're showing in those early peaks that we have enough ventilators in our state right now. If it does peak some of those later times, we'll need to acquire some other ventilators. So we have folks focused specifically on ventilators. We have folks specifically focused on our ICU capacity, and we've been working around the clock to help our hospitals with their surge plans as well. And I'll let Secretary Lockridge add anything he wants on the ventilator piece. But right now, the early surge, it looks like we're okay on the ventilators, and you might speak to the hospital beds.
Sure. As the governor alluded to, we have in the various models we have, it predicts various times where we'll reach bed capacity, but the number of required beds remains fairly constant. So in the coming days, we will release the plan that really lays out how it is, as the governor's previously called for, that we will have 2 COVID centers, one in Oklahoma County and one in Tulsa. And then in concentric circles outside of that are the hospital plans to surge up to 40%. And then outside of that are federal partners, FEMA and U.S. Army Corps of Engineers, determining what it looks like for us to have what amount to field hospitals. And so we have multiple layers of response here that when taken in total, we believe will accommodate all the demand that we'll have, both with respect to hospital beds generally and ICU beds more particularly.
Yeah. Additionally, I would add that, it's going to require all of our healthcare systems, our hospitals across the state, working together in a concerted manner and in a plan that allows us to provide the right care to the level of patient that's needed. And so as we put our plans together, we are working with the healthcare community to make sure that we're all going to be moving forward in a coordinated fashion so that we can take care of Oklahomans.
Ken Miller, AP.
Yes, Governor, thank you. My question is, at what point do you think we might get to the realization that an absolute order to shelter in home is needed, or even to stop, as some businesses are doing, restaurants come to mind, curbside service?
So we're monitoring these on a daily basis, but when we look at the stats, a lot of this is about personal responsibility. And I think Oklahomans have done a tremendous job of social distancing. They've done a tremendous job of letting people work from home. And we've got that safer at home policy in place across all 77 counties. I did that a couple weeks ago for our vulnerable population, or over 65. And so even when people get out to the grocery stores and they have to go to the pharmacy, we know we have to be out of our house. It's not practical to bunker in the whole society through the end of April, or certainly not beyond that. So even when you get out, I'm reminding Oklahomans we all have a duty to make sure that we keep our social distances. And again, I think they're doing a great job. When I'm out, we see when I have to go someplace, you have to elbow bump, and so we are certainly keeping our social distancing. But we're monitoring all that, and we're going to make the right data based on the scientific data that's happening in Oklahoma, and that's where we're at right now today.
Paul Money's Oklahoma Watch.
Thank you, Governor. Just wanted to check in on the staffing needs for if you need to field hospitals around the state, and also, what the staffing needs on the surge top looks like.
Staffing needs. You want to speak to
Right.
that?
So as we are working with the hospitals across the state and asking them what they can do with their capacity should we see a surge, they're also looking at plans and staffing plans, what they would need to do. When you go into a crisis situation, sometimes you are required to staff at a different level. And so different standards of care exist when you hit a crisis stage. And so all the hospitals are looking at that currently. As we work through that with them, it helps us to understand what we need to do, but we're certainly looking at licensing, early graduation for nurses, and things that would allow us to increase our healthcare capacity through staffing.
Janelle from CNHI.
Hi, Governor. I had a quick question. I wondered at what point we would consider shelter in place. I know a lot of people thought that might be coming today.
Yeah, when I say non-essential businesses statewide, and I say the vulnerable population are safer at home across all 77 counties, again, when you look at what I've put in place, I think it's the right. I'm setting the right tone for Oklahoma. Again, this is all about social distancing. This is about making sure that we take personal responsibility. And even when you get out and you go to the grocery store, you get out and go places, you've got to remain 6 feet apart and lower that transmission rate. So what we've done by extending it through April 30th is the right thing for Oklahoma at this time.
Trey Savage, Non-Doc Media.
Yeah, Governor and Secretary, thanks so much for the time today. Yesterday, there was a letter sent by the Commissioner of Health, Gary Cox, to private laboratories asking that they follow or comply with state statute reporting both positive COVID-19 test results and negative test results. I know that on their website, it specifies with an asterisk that the negative number does not reflect private labs. And I think to this point, many, if not a plurality of the tests done on Oklahomans have been conducted by private labs. So can you speak to the need for compliance with that from the private labs? And do you have maybe a more robust estimate of the total number of people who've been tested? Because we're seeing national media talk about how Oklahoma has the fewest tests in the country, and I'm kind of wondering if this plays into it.
Sure, very quickly, Trey, and then I'm going to hand it over to Dr. Shrum, for whom this is an area of deep expertise. But the reason that we need to test is we do need to see both where it exists in the community, and we need to get the denominator of our math up. And that's really the call on the private labs, who to date have provided their positives but not their negatives. The letter you would have seen come out from Commissioner Cox is designed specifically to do that, to require the reporting of our negatives. If not, we only have part of the equation. But I'll let Dr. Shrum opine on just why it is that that's important and the mechanism by which that works.
Absolutely. So it is very important that we both understand the negatives and the positives, and that everyone is reporting in. As we've talked a lot about modeling and the data, the tests are the data that help us see into the future. So testing more people is important, understanding whether that's positive or negative. And as the governor previously stated, testing more individuals, we have that capacity now. So the more testing we do, the more we understand what's going on out in our communities across our state, and helps us to better look into the future through modeling of that data. So it is important for us to understand both the positives and the negatives, and it has been more challenging to get the negative results back. As we look across the United States, Oklahoma, in the number of tests, we were experiencing the same challenges that many others were. And the governor called on the research universities to be innovative, and OSU was stepped up in a very innovative way to partner with Stillwater to expand our testing capabilities. And that has become something nationally that land-grant universities are reaching out to Oklahoma State to look as a solution for the states that are also struggling in this way. And so we're proud of that. We are also looking forward to seeing the number of test results come back in, again, so that we can get more and more clarity on what's going on in the community. It helps us to project and look into the future.
Kelsey Hill from Channel 4 had a question. She says, we've had viewers ask us if they can have their hairdressers come to their home for color treatments and haircuts during the stay-at-home order. Are you making any licensing allowances to allow hairstylists to go to their clients' homes to do this?
I think that's a great point. I'll take that into consideration and release some guidance on that. But as long as you stay out of groups of 10 or more, we understand that there's things like that you're going to have to continue to figure out ways to do.
Trevor Brown, Oklahoma Watch.
Yes, thanks, Governor. Some other governors have complained about having to compete against other states to acquire equipment, specifically ventilators, even likening it to bidding on them on eBay. How has the state's experience been, and what are some of the obstacles in the way of acquiring this equipment right now?
Sure. It is hard. We live in a capitalist society, and sometimes those impulses show themselves in more challenging ways. I will tell you what Oklahoma has done. So with specific reference to personal protective equipment, we didn't rely simply on the federal government's supply. Certainly that's been integral to our effort. The Strategic National Stockpile, of which we've talked a fair amount, is our stockpile of last resort for our medical community and our providers. But we didn't wait on that. And so very aggressively, we undertook to tap the private sector. And so as that stands right now, and this is indicative of what our experience has been, we went to the open markets and we put in bids. And frankly, we moved more swiftly probably than we've ever had to before as a state government. All of this is part of the competitive nature of acquiring things like PPE, but those are critical, again, for our frontline health workers. And so as we speak, we have multi-million-dollar orders, for instance, of N95 masks and KN95 masks that will be arriving, the first of which is today. And then over the next 3 and 4 days, we will be receiving the first parts of those orders. Those were put out on the open market. It has been a competitive situation, but I'm proud of how the state's responded in making sure that we provide for that equipment for our frontline workers.
Matt, Medill Record.
Hey, Governor. My question is regarding a stay-in-place order. Is there some hesitancy on your part to do that? Because there are more vulnerable populations than just people who are over 65. And you talk about distancing.
Yeah, well, if you'll read the executive order, it's talking about the vulnerable population, which is over 65, but it's also those with compromised immune systems. And again, this is about personal responsibility, and so I think we've done what we should do. And when you talk about the essential businesses across all 77 counties, then defining those as the social gathering, but I am a realist in the fact that you could make all these, hey, shelter at home, but ultimately it comes back to personal responsibility. We know that people still have to go to the grocery store, so how do we do that safely? So I'm approaching it more telling people exactly, here's the guidelines. We have to take personal responsibility. We have to continue the social distancing. Businesses have to continue to innovate. That's why we went to the curbside delivery. We've expanded it to all 77 counties now, even the counties that haven't had a positive case, because I want us to be safe. These next 3 weeks are going to be critical in Oklahoma, and that's why I'm letting Oklahomans know it is up to us to take care of each other, our neighbors, ourselves, and stop this spread so we can get through these next 3 weeks and get on the other side of that curve. So that's kind of my job as governor, is kind of set those parameters. And like I said earlier in my opening remarks, there's some mayors, or there's some folks, county commissioners, people that are in certain cities that may want to take additional actions. These are times when we have to protect public health, but ultimately this is a personal responsibility, and I don't believe that we can arrest people or do that. We've got to again go do essential services. There's pharmacy, so we've got to be safe when we go do it.
Justin Schreier, News on 6.
Hi, Governor. How come you haven't really extended your safer at home order to really include everyone in the state? We've seen there are many states out there right now who have a similar safer at home order, and they've applied it to every single person across their states to really flatten this curve.
I don't know if everybody's heard the last questions or not. I've answered that 4 times. So next question.
Taylor Adams, KFOR.
Hi, can you hear me?
Yes, go ahead.
Thanks, Governor. I hear what you're saying about answering this question. Mine is just simply your message to Oklahomans. We have so many viewers who are frustrated. They feel like you're not doing enough. What do you say to those viewers? Do you feel like you're doing enough to protect Oklahomans' lives?
Yeah, I believe so. I mean, I'm telling Oklahomans we're modeling for the peaks in our hospitals. We're all in a tough situation. We're trying to stop the spread of COVID-19, and as governor, I can't wave a magic wand and make this thing disappear. We're presenting the facts to Oklahomans, and we have to remain safe. Our vulnerable population has got to stay or is safer at home, and needs to kind of take that advice and only get out when absolutely necessary, to the grocery store, to the pharmacies. That's why we've got non-essential businesses that we're saying, hey, we can't do non-essential businesses for the next 30 days until April 30th. That's why I've stopped elective surgeries to protect PPE, and also to be able to flex up with our nurses and our doctors as our hospital needs grow. But right now, we have 2,500 open beds in our hospitals across the state. I track that number every day. We've got ICU beds that are open and available. We've got excess ventilators, and this is without the 40% surge plan that our hospitals are working on their bed capacity. But we're getting prepared for the worst. We're obviously praying and hoping for the best. But ultimately, at the end of the day, we have to take this seriously, Oklahomans. We've got to keep ourselves safe, but this is a personal responsibility issue. And in my opinion, I cannot shut down and bunker in place. It sounds good, and it's kind of a soundbite, but it's unpractical for us to do a bunker in place for the next 30 days, because not everybody can get their food delivered. We have to get out and do some things. So that's why my message is social distancing, making sure that we wash our hands frequently, that we stop the personal interaction. And I think we've done that very well. And I think Oklahomans, for the most part, have been very responsive, and businesses have been innovative, and we've been doing a great job with that.
Ben Felder, The Frontier.
Yeah, Governor, do you think the number of positive cases will be lower right now had your original order that targeted 19 counties extended to all counties across the state?
I don't think there's any way to speculate on that.
Barbara from the Tulsa World.
Hi, Governor. I was curious, at the last take one from Cass.
Cassie, the Frontier.
Oh, I'm sorry. I don't think I had a question.
We'll wrap this up for now. Thank you, everyone.